Dr. Ghatan, you explained how to remove, hair and how to make them even perhaps less growing. What about the opposite? What about getting bald, not having hair? Can there something be done about that? Not everybody will want it, but some people might want it. What's the deal there?
Well, hair loss, especially in women, is very devastating. A lot of men also are devastated by the hair loss. It's extremely common. We all expect to lose some hair. It is normal to lose about 100 hair a day. That's normal. But new follicles wake up basically and new hair grows, so we don't have that baldness. But there are people who lose hair and keep losing it and they don't replace it. So that's where we come to help. There are many different reasons for hair loss. There are different kinds of hair loss. We first have to find out what is the cause. And once we know what the cause is, then we can treat the hair loss accordingly. There are times, for example, alopecia areata. It can be helped with injections of steroids at the site of the hair loss. We get great results with that. People have loss of the eyebrow or the eyelashes or the beard. It's the same thing, the alopecia areata, and that can be helped substantially with these injections.
What is that word you're saying? Artificial areata?
Alopecia areata.
That sounds like an Italian
Basically,
word.
Alopecia means hair loss. Areata is basically a localized area. If somebody has a total hair loss on their scalp, they're going to say alopecia totalis. If the hair is lost on the whole body, then it's called alopecia universalis. Alopecia means hair loss as a generic term.
Okay.
Now, there are other reasons for hair loss. For example, stressful situations, loss of a loved one, or say a very difficult pregnancy or surgery or C-section, postpartum. A woman can lose hair, and that hair loss can last 6 months or a year or so. But the good news is that hair can grow back. So at least in this kind of situation, we can be reassuring if we diagnose it, and we can tell them, look, you don't have to do anything. Just go about your business, eat a proper balanced diet, and hopefully within a year or so, the hair should start to grow back. Then there are hair loss that are associated with some disease. So for example, in children, if there is a fungal infection, if there is what you call a ringworm, and it's not treated, they can have hair loss there, and if it's not treated for a long time, it can be permanent. So then, in that situation, we're going to give an antifungal and treat the ringworm and get rid of it, and the hair hopefully is going to grow back. There are situations there people could have lupus or some other conditions that can lead to hair loss. But the most common case of hair loss is called androgenetic alopecia, which means a kind of hair loss that's related to hormone changes and hereditary. The hormone changes may not be detectable initially or at all at any time. It could be the hair follicles are much more sensitized to some of the hormones, and because of that, the person loses hair. At any rate, this is common in men. Most men do get some degree of hair loss, but it's seen in women also. I don't know the exact statistics, but it's a huge number. So when it comes to men, there is not much of a workup to do. Mostly based on a physical exam and history, we can diagnose and then suggest a treatment plan. And we do have a nice treatment plan here. In my office, we combine a treatment with the local topical medication, oral medication, and a special laser that helps hair regrowth. And all three together seem to be much more effective. And if people cannot afford all three treatments together, then we give them a combination of one or the other, and they do see some results with that also. In terms of the ladies, we would like to do a more thorough workup. We would like to do some blood tests, get more detailed history, and if need be, if there's a suspicion, we would refer them to an endocrinologist to check their hormones, to see if there's any other process going on, and to deal with those other issues. And then we deal with the hair loss issue as we do with the man. And we do have the treatments that are very effective. If the hair loss is very severe and the medical treatment may not be effective, if the patient has donor hair, say for example the back of the scalp, they have enough donors, then you can go to a transplant surgeon, a person who does hair transplant, and they can take these hairs from the back of the scalp and plant them here. And that's the best treatment. It's long-lasting because the hair back here is programmed differently than the front. They program to last many, many, many years. So it's a great treatment. So there are different
is that done in your practice also?
Available.
Hair transplant?
I do not do hair transplant. I was trained in it, but I'm not doing it at the present time. I do refer patients who want to do it to other physicians to do it.
Right. But you're a good place to start to get the full examination so that the patient gets the scope of which treatment might possibly be better for it, and then he can go to that specialist and or get something in your office from the staff you mentioned.
Right. Majority of the times we are able to help the patients in the office. We can do things for them to help them, and they do see results. They do get results from the treatments.
Yeah, wonderful. Yeah, because I mean, obviously, with no doubt, some people even are very young, they do shave their head and they want it that way, and that's one thing. It's just for the people who don't want it. They want to have more hair, and most likely, obviously, ladies, because gentlemen, guys, like you having no hair, that has been around, that is there, and it's sometimes very much chosen. So even at young age, I had a couple friends who that's what they did. And after a few weeks, months, you get very much used to it. You don't mind it at all. At the beginning, you go, "What did you do?" But after a while, it's just as normal. But I don't think one sees that with ladies. So ladies definitely the second the hair starts falling out, they get a little frantic. And so there is obviously they should go to a doctor and find out what the source is and what can be done. Dr. Ghattan, thanks a lot.